Okay, welcome back. We're going to talk now about lab processes, post-mill processing, what the next step is after you've milled the restoration. Okay, so as I mentioned before, we want to make sure that we know where that sprue is relative to the finish line. All right, and this is where it becomes very important because you see you have nice finish line and then the sprue is giant. A lot of times on these hybrid abutments, the sprues are very tall. That can create some significant challenges. So you see where the sprue is here, it's away from the margin. Margin's there, sprue's up there. Here it looks like the sprue is actually along the margin line. So that could create a challenge. This is one of the reasons why we want to intentionally try to position that groove, and you can see the groove up in the translucent area of the ceramic. We want to position that groove intentionally to the mesial, the groove should be positioned to the buccal or lingual so that the sprue is intentionally positioned on the mesial or distal, not the buccal or lingual. Now the lingual may not be too much of an issue, but the buccal oftentimes becomes an aesthetic, cosmetic concern, especially when there's an anterior crown with an abutment involved. All right. Take case in point. This is a posterior crown, and you can see this is a significant challenge, right? We've got the margin, and then you've got the sprue, which is up over the margin, Now, would there have been any way around this? I mean, potentially we could have got this connected to that side, but because of where the crown has to connect against the base of that specifically milled MO block, there's oftentimes no way to get around it. So what's the solution? Try to design a single block restoration, a screw retained restoration. Try to avoid designing cement retained restorations when there's a challenge there, primarily because of the issues with sprue placement after milling. All right. So once the restoration, whether it's a screw retained individual crown or a hybrid abutment, comes out of the machine, you want to check the fit on the TiBase. Now be very cautious because the only place that's going to be actively touching the TiBase is literally right where the opening is. They're designed just like a crown is on a patient. They're designed with a cement space in between them. So I always tell my assistants and my associates, whenever we're bonding in a CEREC made crown, you never ever want to have the patient bite down on the crown before it's cemented. And why is that? Because you've got one point of contact between the restoration and the tooth, and that point of contact is the margin. It's engineered so that there's only the margin contacting. No matter how good your design, no matter how smooth and rounded your internal line angles are, if you put any pressure on that, whether it's oriented incorrectly or if the patient overbites and clenches past maximum intercuspation, then it's very easy to separate, to fracture a zirconia or a lithium disilicate crown because you only have the margin that's supporting the weight. Until the cement's in place, you do not have the patient bite down on a restoration. I've seen so many frustrated assistants and doctors, myself included. We just don't do that. So first step, check the fit on the TiBase. Be cautious, don't put too much pressure on there. Second step, remove the sprue. It's helpful to mark it. You can see you've got the little pencil marking. I like to use a fine diamond. I would encourage you never ever to use green or black grit diamond. Use only red or yellow, the fine or super fine. Because the red or the yellow will introduce microfractures. Even though you're firing this material, you'll still potentially get some score marks from the drilling. So always only ever use fine or super fine or carborundum. All right. So removing the sprue, carborundum disc or fine diamond, mark with a trimming pencil. Here is my red stripe. Excuse me. Here's my red stripe diamond. I like to use a flat. I don't like to use, an egg-shaped, a convex shape. Will tend to create these little gouges in there. It's much easier to do a nice, straight, smooth cut with a straight diamond. And again, marking it just makes it that much easier. So we've got some choices of how to treat the ceramic after it comes out of the machine after we've removed the sprue. Generally speaking, I like to do this one right here. So the restoration, whether it's the hybrid abutment, and again, this is a hybrid abutment with a TiBase on it. And this is a hybrid abutment crown with a TiBase on it. So hybrid abutment and hybrid abutment crown. So I like to treat these generally with this technique, where I will polish, and then I will stain, and then crystallize, right? Use the combination of firing until you get a nice aesthetic restoration. Now sometimes if there's some high-end, really challenging aesthetic case, I'll go ahead and fire it right here, and then add this characterization. If it's an anterior case, I like to put it in the patient's mouth and actually paint the glaze or the stain on in the patient's mouth. It helps a lot. But generally you have these three choices. Number one, we polish it. Number two, we polish it and then fire it. Number two, we stain it when it's blue and then fire it. Or number three, we fire it and then stain it and then fire it again. Any of these work, whatever works for you, whatever floats your boat is perfectly fine. So here's what I like to do if I'm just polishing. The staining and glazing is a totally separate lecture. Excuse me. It takes a little more time than we have in this lecture series. Maybe I'll put one together for that. But for polishing, this applies to every single one of those three processes. So here's how I like to polish. I use really two things, blue wheel or gray wheel, whatever you want to call it, an extra stiff brush, and some polishing paste. So this is number one, this is number two, and that includes these. Really, it's three things. And let me demonstrate that for you. Make sure you don't polish or alter the margin of the ceramic. Do not polish or alter the shoulder of the ceramic. And this sometimes is difficult to get the dental assistants, if you're delegating this to them, to avoid these areas. You do not want to round this or that, any of that. That needs to be, or this of course, needs to be sharp edged. You want them to leave that alone, kind of like your internal margins on a crown, right? It has to be sharp. Polish technique. No polish, wheel only. Here's the no polish. Sets straight out of the furnace. Here's just the wheel. You can see we've got a little shine on it, and then this area only, right there. This area there's no glaze on that. That's a wheel and a brush with polishing paste. So you can make these restorations without any glaze look beautiful. All it takes is a few minutes, a little attention to detail, and the right instruments. But yes, adding some stain, customizing it, helps a lot. There it is again. So look at that reflection. This area is not polished to give you a little difference. And that's not glaze. See, it's not fired. That is just polish and paste. All right, let's talk about crystallization. So the P1 cycle, which is a 24-minute firing cycle, 24 minutes and change, for all implant and bridge restorations. The reason for that is it allows about 40% increase in cure rate and crystallization rate, which yields a higher strength restoration. Can you run it on P3 and get the color change? Sure. Will it end up being as strong as it could possibly be? No. And it's 40% stronger on P1 versus P3. So whenever you're in doubt, I would make sure you use this P1. And you can see we got a pointed pin. When you mount it, you want to make sure that the metal is not touching the ceramic, and that the only thing that's touching is the ceramic is the object fix. All right, so prepare yourself for the time it's going to take. It's a 30-minute firing cycle. So if the patient's waiting, you need to let them know reasonably how long it's going to take to get the restoration done. After crystallization, what do we do now? Well, we got to prepare the TiBase. Okay, preparing the TiBase. How do we prepare the TiBase? Two steps. Number one, micro etch. with 50 micron or smaller aluminum oxide particles. All right, that needs to be done in ideally a little micro cab, something to protect you. You can do it in a Ziploc baggie, that's fine. You'll end up getting a bunch of particles out of it. But there's a certain area that we want to micro etch. Not the whole thing. And make sure you're using the right material, okay? Not this. Not the alginate tray cleaner. Not the laboratory pumice. I had an assistant put pumice instead of aluminum oxide into the thing, and it just was weird. It kind of clumped up, didn't work, didn't come all the way through. It was a mess. So make sure you got the right thing, all right? And then we're only going to micro etch certain parts of it. We're not supposed to micro etch Emacs, and we're only going to micro etch the areas that are above the rim of the TiBase. That's the area that needs a little bit of additional micromechanical retention when it comes to connecting to the adhesive that we're going to use. All right, conditioning the TiBase. After we micro etch the TiBase, we're going to condition it with silane, and it should be silane, just straight up silane. You can use monobond S as well, but silane is what you want to use. 60 seconds, dry only, do not rinse. And you see I've got my watch right here looking at the time, okay? And you can see how gray those are. They've been grit blasted with the 50 micron aluminum oxide particles. You can see that right in there. All right, and here is how it's done. Excuse me. Don't over etch. Avoid the screw channel. Only etch above the rim. Okay. You can see on that right side, this one right here, that you can still see some of the loading. Alright, NBA 5.0, you can see that, but you can see that it's coarse. It's rough, right? And here is how I'm micro etching that. Okay, inside a microcab, I probably should have gloves on. But inside a microcab, protect your eyes, protect the surroundings. Don't get the screw micro etch because that'll cause issues for retention strength with the screw. Make sure you take the screw out of the TiBase when you're doing it. But then we want to just micro etch these areas here, not inside, not below the rim, just up above the rim. All right. Preparing the ceramic, pretty simple. It is just a ceramic after all. You have a couple of choices. If you're using hydrofluoric acid, depending on the strength, don't use any more than 20 seconds on Emacs. That's for 9.6% hydrofluoric acid. Only 20 seconds. You over etch it, you're going to actually decrease bond strength. Then if we're using silane, wait 60 seconds after you've applied the silane, and then dry it only. Do not rinse it off. Okay, and make sure you protect yourself from these two, because these two are really nasty chemicals, very nasty. Keep it out of your eyes, wear gloves. You could really do some damage to yourself if you get this on your skin. So it tends to get into your skin and can cause some paralysis and some anesthesia. So be really, really cautious, really cautious. Or you can use a one-step. I like to use this monobond etch and prime. Takes the place of the hydrofluoric acid and the silane for the ceramic. Do a 20-second scrub and then wait for 40 seconds. Rinse it, dry it, done. You don't need to silanate it at all. This is one of my favorite. I use this for my crowns. I use this for inlays and onlays and veneers. It works really, really well. The idea is you want to treat any area that's going to be bonded, so not just in the channel where the TiBase will go, but also up where you're going to put a patch of composite after it's seated. All right. So how do we attach the TiBase?